This is my client. I have not examined her today. She returns after being, it's been 2 days since her second visit, and she's going to just bring us up to date and let us know how she is doing.
So when I came to Dr. Hesch, I was in chronic pain on my right leg, from my knee all the way up to the top of my hip. I felt I was walking with a limp. After our first treatment, it seemed quite magical actually, where I left here without any pain. I didn't walk with a limp. I felt very balanced. We did a lot of work, but I felt as if it was gentle yet kind on my body, where my body took the adjustments very easily. The second day, I did have a little bit of an issue with the top of my hip and just ever so slightly on the right side of my thigh. That dissipated last night. I do a lot of sitting. At this particular point, I'm in school, sitting a lot of hours, driving to and fro, and I had zero issues sleeping, for one. That was a good point, where I had pain on my right side when I was lying down. I have slept well for the last 2 days. I have been in class for the last 2 days as well, sitting for about 4 hours. I've had no problems sitting in a chair for 4 hours, which is quite uncommon. I've had to always get up and move around. As I was telling Dr. Hesch, I felt like I had ants in my pants because I was up and moving around all the time. Now I feel beautiful. Today I'm back for my third day, going to learn some self-treatment and take it from there.
Very good. That's great news.
Yes, it is. I'm
Yeah.
very excited.
Yeah.
I'm
Very
really
good.
excited.
And once again, you would call this an example of miserable malalignment?
That is correct. That was correct. Miserable malalignment. That is absolutely
I haven't
correct.
used that terminology.
Well,
Some people like that name, some people don't. But
was
I think
miserable.
yeah.
I was miserable.
You
that
knew
is
your
for sure.
body wasn't working normally.
And I could not fix myself. And as a clinical massage therapist, I know a lot of ways to fix myself, which I have in the past. But I cannot fix myself from the back.
Sure.
And this is where someone with that ability to treat me can do that effectively.
Very good. Usually what I find on day 3 is that everything has been well maintained, such that I don't need to treat the client. Sometimes that's not always correct, but most of the time it is. I think that you're going to be one of those in which I don't need to do anything to you except to teach you a little bit of stuff you can do once or twice a week, and just make sure it doesn't come back, or if it should come back, you'll know what to do for it.
That's correct. I like self-treatment. I like taking care of myself. I don't want to visit someone over and over and over again, because I feel as if we are here, we need to take care of ourselves.
Right, absolutely. Very good. Well, thank you so much.